Thank you very much. So I just first want to start off by thanking Alicia and Sakura for the opportunity to be able to present this particular material. If you have or haven't actually either listened or attended one of my workshops or lectures, this information is pretty much geared towards regulatory compliance with a little bit of practical application thrown in there every once in a while. So just bear with me. It can be dry at times. I'll try to spice it up a little bit, but safety is what it is. It's not all that exciting, but it's something that we all have to understand and to carry out throughout our workday. This workshop is specific to histology, so for those of you that have sat in other safety lectures, either at your facilities, academic institutions, hospitals, and you listen to bloodborne pathogens or any other regulation-driven presentation, it's kind of generic. This is actually specific just to histology in the type of work that is done in a pathology laboratory. There will be stories, even though it says that I'm the manager of global environment, health, and safety. My life prior to that was 14 years as a laboratory supervisor or manager. So if there's something that has that you can do that is not that smart, I've probably done it or have seen it being done. So I will share some of those experiences with you. But I am actually a histologist originally that just got into environmental health and safety. If you are a supervisor and you're listening to this, pay close attention because ultimately supervisors need to understand these regulations and then also make sure that the staff that report up to them follow the rules. It's up to supervisors and managers to make sure that the staff members are following the rules and take any appropriate action when necessary to ensure that they actually do what they're supposed to do in terms of safety. I do like audience participation for this particular webinar. We're going to actually go ahead and there'll be questions, but at the end of the presentation I'll actually answer the questions to the best of my ability. I will say whatever you do in your laboratory is what you do. Just because I'm going to say some things in here, unless I say you have to do this, these are typically recommendations based on my experience and my knowledge of the regulations and the science of histotechnology, but I don't want anybody going back and saying, oh, Jason said that we have to do this, because I don't want any angry supervisors or managers calling me up asking me to go ahead and explain why their staff members are saying that I said that they had to do something. I usually point out the safety exits for these presentations. Obviously, that's not really all that practical with the webinar. So if you do have to evacuate, hopefully you know where to go. Again, these regulations, they're mostly they're pretty much all geared towards OSHA, which is the Occupational Health and Safety Administration, that it falls under the Department of Labor. And what I do is I actually break them down into plain English rather than give you a lot of legalese that you won't be able to understand. And again, there will be some practical safety information reviewed during this presentation. And then lastly, if you do have an opportunity to fill out or provide feedback or comments regarding this, again, it's a webinar, so it's not as engaging as though it was in person. But if there are suggestions based on this being provided in a webinar forum, please let me know, and I definitely modify this and revise it as necessary to make sure that it's fresh and applies to what everyone's doing currently. Okay, so this is my first slide. Safety at work sometimes is really important. Hopefully you're not this fork truck driver carrying this large ordnance, which in the military, which I was in the military, what we call an ordinance, which is basically just a big, huge bomb. So sometimes it's really important. Okay, so this is what we're going to review in this webinar. We're going to talk about OSHA standards, the occupational exposure to hazardous chemicals in laboratories, the hazard communication standard, the formaldehyde standard, bloodborne pathogens, and then also personal protective equipment. We're also going to discuss some potential monetary imposed fines that OSHA may fine you based on if you need to promote a certain safety atmosphere. Sometimes if you're speaking with administrators or other people, they really don't understand, and so you can say, look, if we don't do this, this is the potential impact in terms of fines that we could incur for noncompliance. I'll also discuss some useful links and then also references on where I actually found all of this material. So the first particular module we're going to go over, it's called Occupational Exposure to Hazardous Chemicals in Laboratories, and this is kind of jumping ahead of me. Okay, so it's commonly referred to as the lab standard. So if you've actually ever heard anybody talk about the lab standard, it's specific to the actual laboratory type setting. So hazard communication, which we'll go over next, is different than the lab standard. The intent was different. This was specifically designed to cover hazards associated with laboratories. And then it also includes an actual chemical hygiene plan. This is a written document that you actually have to have for your laboratory, and we'll discuss some of the things that it actually reviews, but you actually have to have a written program. It applies to all laboratories that utilize chemicals on a lab scale in use. So lab scale in use, what that actually means is you have multiple small volumes of chemicals. You're not working with tanker trucks or in some cases you would work with 55-gallon drums, but typically not so much. It's also performance-based. What that means is it actually applies to your particular laboratory. So you can't take my chemical hygiene plan and apply it to your laboratory because it's based on the hazards that you'll encounter. There are also best practices listed in the Appendix A of the OSHA standard. So if you need some guidance to develop your own chemical hygiene plan, you can find that within the actual standard itself. And then it does supersede the hazardous communication standard for nearly all histology laboratories unless you fall into one of the other categories, which I'll go over shortly. So we'll go over real quick what the chemical hygiene plan is supposed to have, because it's supposed to reference each one of these things within the chemical hygiene plan. So hopefully you actually have this particular document. So employee exposure. So this is where we discuss permissible exposure limits. Hopefully you've heard that term before. It's called a PEL, and it's a generic laboratory regulatory limit on the amount or concentration of a substance in the air over a determined period of time, and can include maximum allowable concentration in the air for any exposure. So typically it's 8 hours a day, 40 hours a week, 52 weeks a year, and then that's what they determine is a permissible exposure limit. And they're based on, they were developed a long time ago, so they were actually based on a healthy 150-pound male adult. Well, last time I checked in the histology profession, that doesn't really represent everyone in the profession, so you need to keep that in mind. So if you do suspect that the permissible exposure limit is exceeded for any chemical you work with, you need to consult with your supervisor, and you may have to do industrial hygiene monitoring, which we'll discuss during the formaldehyde module. It may be necessary. Formaldehyde and xylene are actually the two most common chemicals to be monitored for employee exposure in the laboratory, and that can be either a time-weighted average, which is an 8-hour time-weighted average, or a 15-minute short-term exposure limit, which we'll review in the formaldehyde section. So chemical hygiene plan. So it's a comprehensive document that includes policies, procedures, and guidelines to protect lab employees. You actually have to have SOPs and personal protective equipment required when working with specific chemicals. So that may be included in a training manual or something else. You have to include criteria that your institution, hospital, or workplace will use to determine and how to control those particular hazardous chemicals within the environment. You have to have the proper use of personal protective equipment and engineering controls. Personal protective equipment everybody kind of knows, but engineering controls, that's a chemical fume hood, a grossing hood, a sharps container. Those are considered engineering controls. They're actually pieces of equipment or other things that control hazards at the actual source. It also has to include some employee training, so it's based on the hazards in your lab. Like I said, it's performance-based, so you need to make sure that you need to understand exactly what hazards are associated with in your laboratory. So you may have to have annual training, training every 3 months, so you need to discuss that in your chemical hygiene plan. You need to discuss when prior approval is needed for a procedure. So just to give you it in terms that you that you can relate to. So if you're doing a Gamori versus a Mason's trichrome stain, so with the Mason's trichrome, you're using a lot more reagents than if you were just doing a Gamori trichrome stain. So if there are more reagents used, that has to go through an approval process, which needs to be included in your chemical hygiene plan. You also need to include information on medical examination and consultations. I don't get into that a lot because it's physician type work, so or medical type work. So you need to have that in the plan. You need to designate a chemical hygiene officer. That must be an employee. You can't have a contractor be your chemical hygiene plan. So you have to make sure that you designate a chemical hygiene officer that is an actual employee, and then you have to talk about when you work with hazardous substances, which include carcinogens, reproductive toxins, and substances that have a high degree of toxicity, such as chromic acid. That has a high degree of acute toxicity. Then you have to discuss where you're going to be working with these, what type of work practices you're going to use, and then how you're going to handle your hazardous waste, and then if you do have a chemical spill, how you're going to decontaminate and mitigate and control that spill. So it's a lot of information that's actually required in a chemical hygiene plan. The document needs to be reviewed annually and updated as necessary. That's typically done by the chemical hygiene officer. The formaldehyde standard actually supersedes the lab standard. And again, we'll go over that because I am going to discuss formaldehyde because it's a regulated carcinogen according to OSHA, and a separate standard altogether actually applies to work with formaldehyde. So that's to consider. You have to, so when I talk about employee information and training, so before you even go into the laboratory, you actually have to have training associated with the hazards that are going to be encountered within the work that you're going to be doing. You can't just have someone that's never worked in a laboratory shove them in there and say, here you go, good luck. Well, they need to understand what the permissible exposure limits, how you actually recognize, so is it an odor? If I get something on me, will it turn color, silver nitrate? If I get black little spots all over my hands and I was doing, a silver stain, well, guess what? I may have been exposed because that's one of the indicators that you actually, got some of that silver nitrate on your hands. Then also personal protective equipment, engineering controls, and other work practices so that they are able to understand how to actually use chemicals, work with chemicals safely so that they don't, so they're not exposed. Also, you need to discuss the location of MSDSs and the storage and disposal of chemicals. So all of this stuff needs to be done prior to a person even coming into the laboratory. And then as far as refresher training, so if something does change, you need to do some training, but it can be done in an informal setting. But from my perspective, from working in the laboratory, having people, in the laboratory, I actually suggest that this be done on an annual basis. I did talk about medical consultation and medical examinations. So if you do have signs and symptoms that you've been overexposed, you need to discuss that with your supervisor. You may have to go see a physician if you have an emergency room, if you work in a hospital, or or something else, then you need to actually go see a physician so they can do a medical determination to see whether or not you were overexposed. Labeling. So for labeling, for this purposes, you just need to make sure that incoming containers, the labels from the manufacturer are not removed. Now, your institution may have additional labeling requirements using the NFPA, the National Fire Protection Association, that's the DIAMOND, or the HMIS, which is the Hazardous Material Information System, which is slightly different. So your institution may actually have different types of labeling systems based on what they're requiring. But as long as you don't remove the label, you're okay from OSHA's standpoint. MSDSs you have to have one for each hazardous chemical, must be on file and accessible to everyone that has exposure during work hours. Respirators. Okay, respirators. I don't really go that much into respirators because it's my feeling that if you have to wear a respirator, it's a kind of out of the job scope of what typical histology technician would do. But if you actually do wear a respirator, you have to make sure that you've had a medical evaluation. So that's where you have to fill out this pretty long form, send that off just to a physician or other healthcare professional, have them review it. Then if they feel that you're okay to wear a respirator, then they can sign you off. Then you have to have annual fit testing and annual training. So those two things need to be done for respirators. I could spend probably an hour just talking about respiratory protection. But from my perspective, you want to use either work practices, administrative controls, or engineering controls to control the hazardous vapors and exposure in the laboratory rather than rely on respirators. It's a very labor-intensive standard to keep up with. Last, record keeping. So monitoring records. So if you do monitoring, you have to keep those records for at least 30 years. I would suggest the supervisor or HR does that, or another type of an administrator. For the medical records, they need to be kept for the duration of employment plus 30 years. So those, if you don't have an HR department, then the administrator for the department should keep those. But yes, those, it seems like a lot, but so if you've worked for someplace for 25 years, that means that your employer is required to keep those for at least 55 years. So it's a long time. Training records, I think that the supervisor should keep those, but again, that's up to you. You know, from my perspective, I say that you should keep them for a length of employment plus 5 to 10 years. If that's impractical, then that's okay. But you know, just from my perspective, keeping training records, I've seen them come back to haunt people saying, you know, I was never trained on this, and you know, and then if there's a lawsuit that comes up, you know, it can get a little sticky. So you want that documentation that someone's actually been trained on the particular hazards associated with the work that they're doing. Okay, that was occupational exposure to hazardous chemicals in the laboratory. That's the longest one that we have in terms of review. So the next one will be hazard communication. So hazard communication, everybody talks about hazard communication and they just say, oh yeah, HazCom, HazCom, HazCom. Well, HazCom for laboratories is slightly different. It really applies to a few select in a laboratory setting. One is chemical manufacturers. So if you're a chemical manufacturer, then this would apply to you because it applies to chemical manufacturers. Second, shippers of unused chemicals. I've gotten some dirty looks about this one. So if you actually take, let's just say that you have some satellite locations, those satellite locations, they do collections for you, they send them to you for processing, but if you send them 10% neutral buffered formalin, say you fill up cups from a like a 1 gallon, 5 gallon, or 55 gallon drum, you're supposed to label that container and provide an MSDS, and you have to have a hazard communication program, written program that requires an outline of what you actually do because you're considered almost the manufacturer. It's actually pretty. I usually don't want to get into that, so I advise people buy some pre-filled containers, then send them off. Don't fill them up yourself. I know you're going to spend a little bit more money, but from a liability standpoint, you get away from those things. And then third, if you actually go ahead and use very, very large containers, so 55-gallon drums of xylene or alcohol or formalin or any other type, that's not really lab scale or use. So you actually have to have the elements of a hazard communication stand instituted within your laboratory. Excuse me. So so what I will say, I won't get too much into the hazard communication standard because it won't apply to most people because we just spent so much time on the occupational exposure to hazardous chemicals. But I will tell you that if you do have both that apply to you, if you have the hazard communication and the occupational exposure to hazardous chemicals in the laboratories, if both of those apply, then you can have a comprehensive document that contains requirements for both standards. So you can just have one. You can call it whatever you want, but it can be chemical hygiene / hazard communication program or hazard communication / chemical hygiene program. You can combine the elements of both and then have one comprehensive document. There's a letter of interpretation from OSHA that says that you're able to do that. So if both do apply, just keep that in the back of your mind that you don't have to have a cumbersome program that has two different, and you have to make sure that they both match up. You can actually have one program that suffices for both. Okay, that's hazard communication. Okay, next, formaldehyde standard. So I'm going to start this off with a little bit of a story. So this, I was actually working I had mentioned that I was in the military. I went ahead and had my one-man show, and I was filling up large 5-gallon containers of red buckets because I was going to be putting something, specimens in there, and I had 5-gallon cubes. So I figured that I could just go ahead and take the spigot off of a 5-gallon cube and then just pour it off because it was taking too long with just the normal spigot that comes on the 5-gallon cube. Well, I was young and I wasn't all that bright, and so what happened is, if you've ever actually tried to do that, which I hopefully you haven't, it shot out like a rocket and sprayed all over the autopsy room. So formalin was everywhere, and it was probably about 3 gallons worth because it was a new 5-gallon container. So what I did is I went ahead, I had formalin all over my scrubs, I ran back to my laboratory, I got my full face respirator and went back and I cleaned it all up, and I never told anyone about it. Well, I can't begin to tell you how many things are wrong with that story, but it does, it basically outlines that when you're working with formalin, even though people say, oh, it's formalin, it's diluted formaldehyde, it still is actually falls under the OSHA standard for formaldehyde, which is a regulated carcinogen. So people can debate whether or not it causes cancer, but according to OSHA, it's a regulated carcinogen, so you have to take appropriate action. So I talked about PEL. So for formaldehyde, and you probably have heard this a million times, but formaldehyde does have a permissible exposure limit, an 8-hour time-weighted average, so I said 8 hours a day, 40 hours a week, 52 weeks a year, of 0.75 parts per million. So that is very, very low. Not the lowest that I've ever seen, but it's low. Then it also has a 15-minute short-term exposure limit. So this is the least amount that you can actually be exposed to in a 15-minute period. Usually you take where you have the most exposure and you measure that as a 15-minute short-term exposure limit. That is 2 parts per million. And then it also has an action level, and that action level is 0.5 parts per million. And if you are actually, if you are exposed to an action level day over day, even though it's not above the permissible exposure limit, there's still required actions such as posting, medical examinations, exposure monitoring. So if anyone has any questions regarding what type of actions, you can certainly post that as a question, and I can review that during the Q&A session. So I talk about monitoring. I talk about that, and it's really industrial hygiene monitoring. So it's monitoring the level of formaldehyde or other hazardous substance in the air. Monitoring should be performed initially, and if the results are below the established short-term exposure limit and the action levels, then periodic monitoring can be performed, but you can perform it based on changes in procedures or engineering controls. So if you get a new grossing hood or a new chemical fume hood, you need to do exposure monitoring, because who's to say that that's actually operating efficiently enough to control those hazardous vapors. Monitoring can be discontinued. The way that it can be discontinued is if you take two samples taken 7 days apart, and if both are below the short-term exposure limit, that 15-minute short-term exposure limit, and that action level, then you can discontinue monitoring. But again, if you modify work practices or engineering controls, you have to do monitoring again. But I suggest that monitoring should be conducted on an annual basis. And this is just to show everyone, hey, look, you know, it's everything's okay. We're below the short-term exposure limit and the action level, and it's very good data to have, and it's very I think it's very inexpensive. They actually, I have a badge here as a picture. This is a personal dosimeter badge, and this particular badge, you can wear it on your for your breathing zone, and it will actually you have little pouches. You send it back to the company. It costs $50 a badge, and that includes monitoring results. So you can actually send that off, and you'll get a report back, and you'll have everyone, you know, and there's a couple of different companies that actually supply them. If you're interested in getting that information, pose it in a question, and I can certainly get you the information on those monitoring badges. So the next is engineering controls. We talked about engineering controls. So formaldehyde solutions. So when I say formaldehyde solutions, that means 10% neutral buffered formalin. That means Buin solution. Anything that contains formaldehyde should always be used in a ventilated workspace. So either a grossing hood or a chemical fume hood to control the vapors. If you have to use a respirator, you know, that's the decision of your laboratory, but you need to make sure that you're below the permissible exposure limit. You may be above the action level, but again, there are some actions to be taken if you're at or above that level. Personal protective equipment. Here's another place where I make enemies. Lab coat and apron, impervious to formaldehyde. So if you have a lab coat and it's just a cotton lab coat and it just absorbs liquids, then that's not appropriate. It should have some type of protective covering on it so that if the formalin hits it, it beads up and rolls off. That's a lab coat or an apron that is impervious to formaldehyde. Also, indirect vented safety splash goggles. So those are actually required if there is a reasonable chance that a splash can occur. Gloves, preferably nitrile. All of this PPE should be worn at all times when working with formaldehyde solutions. Unfortunately, there is a place in the regulations where it actually says this stuff, so don't shoot the messenger. Emergency equipment. So emergency equipment, you should have safety showers and eye wash stations available when you're working with formaldehyde solutions. Also note that if you do have these available, that even though it's not an OSHA regulation, but they do recognize the ANSI standard, that you need to reach those both of those emergency equipment, both safety shower and eye wash station, within 10 seconds with your eyes closed. So if you have to go through 5 doors to get to your safety shower or eye wash station, then that's a problem. If you have to get to your safety shower and you have to go through a couple of doors, that's fine. Eye wash station, I think those should be readily accessible at the source. in the laboratory. So just keep that in mind. Exposure. So if you exhibit signs and symptoms of overexposure to formaldehyde solution, so you should know that, because if you've actually read the MSDS, it actually has, anybody that's worked with formaldehyde, you get tearing up, your throat burns, anybody that's been exposed to high levels of formaldehyde fumes, those of us that have been in the field long enough probably have, then you actually would go ahead and have to get a medical surveillance or exam to make sure that you weren't overexposed to it. Now that should be offered to you during work hours at no cost to you. So if you actually are exposed, and let's just say that you spilled formalin all over yourself, well, that's still that means that you were actually exposed to formalin in an emergency situation. So you would actually have to be offered medical assistance at no cost to you during normal work hours. So just keep that in your mind. Labeling. So for labeling, this is something that you have to have on each container of formaldehyde solutions. So it should list the following hazards: potential cancer hazard, irritation and sensitization of the skin and respiratory system, eye and throat irritation, and acute toxicity. So they sell all these pre-printed labels. Those are great. You just slap them on the container, and then you're good to go. No need to go ahead and write something out. But just know that each container of formaldehyde solution needs to have that specific language in it or on it. MSDS. So if you have an MSDS for a formalin solution from, let's just say, Fisher Scientific, or I don't know what they're called now, Thermo Fisher, but you're getting your formalin from Poly Scientific, is that okay? No. You actually have to have the MSDS for that specific company and catalog number should be available to you. You can't just have a generic MSDS for 10% neutral buffer formalin, nor can you have a generic MSDS for any of the solutions that you have. You have to actually have it for the specific company and catalog, and must be kept on file in the lab or in a specific area so that it can be accessed during an emergency situation or for just general reference. So if you don't know, training is actually required to be done on an annual basis. That is, there's specific things that are required for the training. The contents of the formaldehyde standard, so it's a very long standard, but you need to have at least a brief overview of the formaldehyde standard, or at least where to find it. The MSDS for the actual formaldehyde solutions that you use, the potential health hazards, signs and symptoms of overexposure and how to report them, the PPE that you're supposed to use while working with these solutions, engineering controls and work practices, and then finally a review of emergency procedures in the event of a release. All of these things must be covered during a training session, and it needs to be done at initial assignment where you're going to be working with these solutions, and at least annually thereafter. Okay? Then you have to have a written, well, before that you should really have a written program, but a written program is actually required. So if you're working with formaldehyde solutions, you need to have a written program. Very similar to other written programs for hazard communication, but it has to be specific for formaldehyde. So it has to be a documented communication program. It's going to describe how the requirements of labeling and other forms of warning material, safety data sheets, and employee training and information will be met. So if you're interested in getting an outline of a formaldehyde control program, you can certainly search for one on the web. If you have a question about where to get one, you can type it up during the Q&A session. I can certainly direct you in the right place. Okay? Record keeping. As I had said with the the lab standard, monitoring records for formaldehyde must be kept, again, for at least 30 years. And medical records, so if you are actually exposed, those must be kept for the duration of employment plus 30 years, so it doesn't change. Then last, the appendices for, for the formaldehyde standard. If you're exposed to formaldehyde solutions in an emergency or exhibit signs and symptoms of overexposure, then the appendices need to be looked at for additional information based on the actions that you may have to take. So just understand that even though they're appendices, they are there for references if there's an accidental exposure to formaldehyde during working with that in a procedure. So, okay, so that's the formaldehyde standard. Next, we have one of everyone's favorites, which is the bloodborne pathogen standard. So bloodborne pathogens, really quickly, because most people are probably aware of this particular standard more than others. So the scope and application. This standard applies to the majority of histology labs if you work with human blood or its components, unfixed tissues, or experimentally manipulated animals that may be infected with HIV or hepatitis B virus. Some people will argue, well, all of our stuff that we get is fixed. Well, if you work in a small derm laboratory, I can understand that. Most of your stuff will be fixed. So this may not actually apply to you. But those of us that may, have worked in hospitals, there's nothing like getting a very large specimen, either a colon or something else, when you first cut into it and it's all bloody red. Well, guess what? Even though it was infixative, it's still unfixed tissue. So you really need to understand that that you still have occupational exposure to bloodborne pathogens, and this particular standard would apply to you. So as the other standards require, you actually have to have a written plan. That is called an exposure control plan. That needs to have very specific information. So just really quick to run down the list, you need to talk about job classifications that have potential exposure, including job titles, a list of procedures with potential for exposure, so grossing, cryosectioning. You have to indicate that universal precautions will be taken when handling all samples, the use of engineering controls when necessary. You have to discuss or at least indicate that hand washing facilities are available, and the proper instructions for handling and disposal of needles and other sharps. And then there's another thing that people get tripped up on, and I'm certainly guilty of this also. There has to be an annual evaluation of safer sharps devices. So every year, with the input from employees, you need to review the new sharps that are out there and document that and keep that record. And I know that people say this all the time. I can't believe you keep on saying this, but yes, mouth pipetting, suctioning is prohibited, and that food and drink in the laboratories, refrigerators, and freezers is also prohibited. You need to include how to properly label specimens and the personal protective equipment that you must use when handling these particular potentially infectious samples. Methods for decontaminating work surfaces. So one of the most common things is just outlining what you do if there's a spill, so bleach or a diluted bleach solution. And then also similar to the lab standard, disposal of biological waste, where the lab standard said disposal of chemical waste. So all of those things need to be in exposure control plan. Next, engineering and work practice controls. Biological safety cabinets, not sure if, not a lot of histology laboratories have these available, but they're for use with, some are actually designed to be hazardous chemicals also, but typically they're designed to be worked with potentially infectious agents. And then also you may have autoclaves. I discussed sharps containers, and other things to actually control potential exposure within the laboratory while working with these samples. Hepatitis B vaccination. Hepatitis B vaccination needs to be made available to you within 10 days of initial assignment where occupational exposure exists, and post-exposure evaluation and follow-up of all employees who have had an exposure incident. Now, usually this is coordinated through your Human Resources Department or another administrative department. So if they say, oh, here you have to get a hepatitis B vaccination, and you say, I don't really want that, well, legally you can decline. So you can sign a waiver saying, yes, they offered it to me, but no, I declined. But if you want it the next day, you say, you know, I changed my mind, they still have to give it to you. So regardless if you decline it, you can always opt to get it in the future. Labeling. So everyone's seen that the biohazard symbol. All refrigerators and freezers, including containers that have human blood, unfixed tissues, or other potentially infectious material, must be labeled with that biohazard sticker. Also, if you have contaminated equipment, biologically contaminated equipment, and it can't be decontaminated, that equipment must also be labeled appropriately to indicate that it's equipment that could be potentially infectious. So if you have someone that's coming in that's going to be working on that equipment, they understand that, and they're not, they take appropriate measures, gloves and safety glasses or whatnot, to make sure that they don't, they're not exposed. Information and training. So training, so this standard is probably the most rigid standard that I'm aware of for training. Training must be conducted at initial assignment where you're going to have occupational exposure, or if the changes in the procedure present a new exposure hazard. But retraining, so retraining must be conducted within 1 year of the previous training date. I have seen them, if we did training today, so March 31st, 2011, and we do training next May for bloodborne pathogens, that means we're out of compliance. So you need to do it basically within 365 days of the previous training date. That I have seen, I mean, if you do it within the same month, you'll probably get away with that, but I've seen them be real sticklers for this lately during inspection, so just keep that in mind. Record keeping, so training records, they must be kept for a minimum of 3 years. This is the regulation. This is not best practice or what my recommendation is. The standard actually says that you have to keep these training records for a minimum of 3 years. And as we said before, medical records, they have to be kept for the duration of employment plus 30 years. So again, same standard for medical records, so it doesn't really change if you've been exposed to a bloodborne pathogen, formaldehyde, or other chemical. That is bloodborne pathogens. Okay, moving on. Personal protective equipment. So this is another particular standard that's getting a lot of visibility lately in OSHA's eyes. And then also, you know, for good reason. When you look at particular laboratories, what they've always said is, oh, what type of gloves can we use? What type of respirator can we use? What type of lab coat? Well, when you're evaluating a hazard, you need to understand that you need to go through a sequential steps to evaluate that hazard and what controls exist to make sure that that you actually have performed a hazard assessment. So each procedure needs to be evaluated for the risks and hazards in performing that task. Then once you do that, before you even select personal protective equipment, you discuss engineering controls. So do you really need a respirator, or can you just use it in a chemical fume hood? So make sure that you do that rather than just looking exclusively at personal protective equipment. This talks about personal protective equipment because this is the actual standard, but just as a good practice. PPE, that should be chosen based on the risks of the procedure. Then you need to train employees. So you need to train employees when PPE is necessary, what PPE is necessary, So let me go ahead and then throw this out there. So as far as personal protective equipment, we all usually have lab coats or gloves and potentially safety glasses. But does everybody have safety goggles? I don't know. They make different types of safety goggles too. They make vented ones, indirect vent, direct vent. And then also face shields. So you need to make sure that that you have all the personal protective equipment that's necessary to perform these procedures that present the hazard. Then you have to discuss how to properly don, take off, adjust, and wear personal protective equipment. You may have to take, you usually have to take off personal protective equipment in a particular sequence so to prevent unnecessary exposure to either chemicals or other biological materials. So if someone takes off, their lab coat and then still has their gloves on and then goes and takes their safety glasses off, well, guess what? You may have contaminated, your safety glasses or your face by still having those gloves on. So you need to, people that haven't been working in the field may not know that personal protective equipment needs to be taken off methodically and not just taken off in any particular order. Then also limitations of personal protective equipment. So is your lab coat impervious to concentrated acids? How about those of us that have used latex gloves and you're actually working with xylene and those latex gloves melt? So just make sure that you that they understand that. And then proper care, maintenance, useful life, and disposal of personal protective equipment. So you shouldn't be reusing things that like gloves and other things that are one use and then throw them away. And then if someone's not using something properly or wearing something properly, then you need to perform retraining and make sure that they understand the importance of it. And then lastly, documentation. So you make sure that you document this, because if if a staff member refuses to wear their safety glasses or refuses to wear their lab coat, and you keep on documenting it, it's all part of that process if you have to escalate it to disciplinary process. So just make sure that you keep that in mind. Okay, next is the job hazard analysis. This is something that you're required to do. Let me just say that a job hazard analysis goes through that sequential job steps based on the principles that we just discussed. And we did this in our particular laboratory that have multiple disciplines, including bacteriology, autopsy, those types of things. And it took us over 2 years to develop these. So my suggestion is to start with high-risk jobs or jobs that have a high injury rate, and use this as a method to look at that particular job task and implement controls to make sure that you address the hazards and take appropriate action to make sure that they don't happen again. So I do have one particular job hazard analysis that I've done. Hopefully you'll be able to see this, but take a look real quick. It's just called a job hazard analysis. The job, you don't have to have this specifically, but it gives you the idea of sequential job steps. I talked about trimming fixed tissue, and then the potential hazard. So is it a chemical hazard? Is it a physical hazard? Biological? Ergonomic? And then once you identified all the hazards, what are you going to do? So what's your control, action, or procedure to make sure that those particular hazards are addressed and you're doing what you need to do in terms of engineering controls, work practices, or personal protective equipment to make sure that you've identified all the hazards. And again, you're not going to be able to get rid of all of the hazards, but you will be able to at least address all of the hazards and minimize the risk as low as you can based on doing this hazard assessment. Okay? Okay, so just really quickly, because this actually gives you some good information. OSHA fines, so serious or other than serious, that's most of OSHA fines, up to $7,000 per violation. A serious fine again, up to $7,000 per violation, a willful violation. So if you knew about this, if it was documented and you did nothing about it, it could be anywhere to $5,000 to $70,000 per violation. And let me just tell you that these particular these monetary fines are actually going up. So they're actually adding zeros to all of these. So think about 70, 70, 50 to $700,000 per violation, because they feel that they're not getting the attention that they need from the people that are actually, not adhering to the standards that they set. So they're really ramping up the fines and also the violations. So just keep that in mind. I also like to point out what are the top 10, because if someone said to me, oh, well, OSHA may come in here, or, bloodborne pathogens, number 1. So when they talk general industry, they mean everybody that's not construction or shipyard. So that could be a warehouse, that could be an office building. So bloodborne pathogens, the number 1. Then HAZCOM, respiratory protection, occupational noise exposure, so high noise hazard, powered industrial trucks, so fork trucks, permit required confined spaces, so those spaces that actually have hazardous atmospheres, lockout tagout, which is someone being electrocuted or other type of hazardous energy, the HAZWOPER, which is cleaning up a chemical spill, guarding floor and wall openings and holes, that's usually stairs and other things, and then personal protective equipment. So you can see the ones that actually apply to the histology laboratory. So 1, 2, 3, 4, 5. So half of them could potentially apply to the histology laboratory. So these aren't, some things that may not happen to you. They're out there. Okay. So here's my useful links. Hopefully you have this presentation so you can go over this later. And then I've also included some references where I received some of this information. So there's links here that you can go and take a look at the standards, and then also some reference material. And then finally, we have my office safety inspection, which is hallway safe, door safe, and we are done. And I'd like to thank everyone for their, for sitting there listening. Hopefully it was enjoyable, but I guess we'll open it up to Q&A. I'll ask Alicia to go on and take control and start that process.
Thank you, Jason. We really appreciate it. That was a lot of information that I'm sure everybody will find useful in some way or another. So if the audience does have questions, please type them in the question box. We do have 2 that I would like to go ahead and address. But this is just one of the products that Sakura offers to help with safety in the lab, and that is known as our Neutralex product. And that is helpful for formalin spills or during grossing with our grossing wipes. This information can be found on our website, and I just wanted those of you who didn't know about it, that we offer this product, the exposure to it. One of the questions that we have, Jason, if you purchase pre-filled formalin bottles, is it the responsibility of the company to properly label the containers?
Okay, so if you purchase pre-filled containers, the manufacturer of those pre-filled containers, the responsibility and ownership is on them. If you're just redirecting them and not taking any, and you're not breaking the seal, and you're just redirecting them, you don't have any responsibility in terms of how it was labeled or anything like that. So,
next question. Does all the quantities of formalin need to be neutralized or disposed?
That is a loaded question. It really depends on where you live. For example, in Massachusetts, our publicly owned treatment works facility, so where all our sewer waste goes, we have a regulation, or we're held to a limit of 9 parts per million for formaldehyde discharge in our wastewater. Well, I can tell you that I have never seen a formalin neutralizing system that will go that low. So it really depends on where you actually live and your wastewater discharge permit. So if you don't know, then I would reach out to the publicly owned treatment works facility or your local town. Typically, it's not as strict as here in Massachusetts. I've seen in California, it's also strict, but that's a very difficult question to answer because it really is dependent not only in the state that you live, but also in the town that you live. So I would just ask people to go ahead and check with their publicly owned treatment works facility before discharging anything that they may feel is potentially a violation.
Thank you. Next question is, please tell me what the label should be on a formalin container concerning hazards.
Okay. So concerning hazards, well, let me go ahead and I'll repeat it one more time, but I will kind of direct you to where to actually purchase some of these labels. Okay, so for the labels, it should have the following hazards: potential cancer hazard, irritation, sensitization of the skin and respiratory system, eye and throat irritation, and acute toxicity. So again, potential cancer hazard, irritation and sensitization of the skin and respiratory system, eye and throat irritation, and acute toxicity. One of the best labels that I've seen is from Anatech. If you search the web for Anatech, they have great labels that have all of that information already pre-printed on there, and they're very inexpensive. For a roll of 500 labels, I think it costs like $15, so very inexpensive. And that's just an example. I'm not promoting one company over another.
Thank you. I have another question. If the companies are out of business and you still have chemicals from them in the lab with no MSDS sheet, can you use another company's MSDS sheet?
That is a tough question. I guess it would depend on how mainstream the chemical is. Say it was 10% neutral buffered formalin. Well, the constituents and characteristics of 10% neutral buffered formalin usually don't vary much between manufacturers. So I would say yes, you probably could, just to make sure that you have the hazards and constituents of that particular chemical available to people that have access to it. But if it's something that can vary significantly, let's just say Bouin solution. There's all types of different Bouin solution recipes. That would be one that you would probably, want to go ahead. And depending on how much you have left, you may want to just, if you have a small amount left, you may want to just go ahead and dispose of it through your waste vendor, and then just get one from the current manufacturer. And then also search the web. Even companies that are out of business, some academic institutions actually have all their MSDSs online. So I would actually go ahead and type in the manufacturer and the actual chemical itself, and just see if you can. I've had some success doing that also.
Thank you, Jason. That's all the time we have for questions today. I hope everybody enjoyed the webinar, and if you haven't already done so, please sign up for next month. Thank you so much for your time.
Okay, thank you.
Thank you.